guys, Bill Parisi here, founder of the Parisi Speed School. I am with Dr. Tim Lyer of Atlantic Sports Health from Atlantic Health System. Excited to have you on today, Tim. I know we did went over some things on our previous segment about the knee. Today we're going to talk about a hot topic, Osgood Schlatters, which a lot of people talk about being a disease, but earlier you said it's really not a disease. Talk to us why young kids get this. Why does this come about? How do we treat it? What's the best way to handle this?
It's an interesting topic. It's very widespread, and there's a lot of concern about it. Osgood Schlatter disease is not a disease because it's a growth-associated inflammation of a growth center. We have to make a big distinction between the growth plate and growth centers. So these are cartilage areas in bone where tendons insert, and while you're adolescent, while your child is growing, the tendon basically are stretched. And if there's too much tension at the insertion of the tendon, as we can see in a second in our model, then these areas gets inflamed. So this is a problem, a condition, an inflammation during the adolescent growth spurts primarily. Most important is to distinguish between more severe knee injuries, as we spoke in the past. You want to make sure that this is Osgood Schlatter. And to come back, the area which is usually the problem is the upper portion of the tibia, the shin bone, where the knee cap tendon inserts. And that is a weaker link, and that can get very much inflamed. You see it with some swelling, you see it a bruise. Very often after a fall, you notice the first time.
And what are the things we can do to treat this I know it's not a disease, but this pain, this issue?
It's important to talk about it. It's important to recognize that there is a lot we can do. So primarily, we want to try to help the athlete stretch better. As I said, it happens associated with the growth spur, so there's a lot of tension. And if we look at typically our 13, 14-year-old boy, they're so tight. So physical therapy, home exercise, stretching program, looking at alignment, looking at the foot in relation to the hip, how does that play? We can locally treat it with some physical therapy, some ice therapy. We can, in more severe cases, use some anti-inflammatory to decrease inflammation, and we can help padding it. We can prevent a direct hit to it by a hockey stick or lacrosse or even falling on it.
Right, because that would create a lot of pain. So the secret is rest, ice, and just letting an athlete just work through the growth.
That is right, and this is, for all our parents and athletes, this is one of the conditions we do let our athletes play with.
Yeah.
But you have to know, and you have to see someone who's familiar with an adolescent sports athlete to make sure this is Osgood Schlatter and nothing more severe, God forbid.
Yeah, that's a good point. So first, in your opinion, it's really not a disease. It's just growth.
It is growth related. We're still uncertain why it happens in certain athletes and in others not. And hopefully in the future we get an answer. But I would go as far as not calling it a disease.
Sure. And it is so common, with so many young kids today. And I think the advice you've given is so sound. Most importantly, rest and stretching and some of the fundamentals. And sometimes kids, they just don't know how to shut it off.
Right.
And as parents, we got to make sure they do shut it off, and even in their play, because even outside playing recreationally, they might have to stop that as well.
For some time, and I think the good thing again is that these children and athletes can continue playing if we have the right diagnosis, and the majority of cases with our treatment regimen are having significant decreased symptoms.
Yeah. That's great. Well, thanks so much, Tim. Very insightful. I appreciate the info, and I know our parents will as well.